Hello, virtual reality friends. Bill Ballo coming to you here from Acadicus. Lots of amazing stuff going on in Acadicus in the past couple of months. And I just want to make sure that you know what's out there so that we can showcase some of these amazing advancements in the Acadicus platform for you. So what I'm going to show you today is actually a patient. This scenario is specifically set up. Coming in, hello. This is specifically set up as a patient with cirrhosis of the liver and has a GI bleed. Hello, how are you today, sir? Well, we're just coming in to do a little demo of what you can do. I'm just showing everybody what you are capable of doing. And so this is going to be broken up into a couple of parts, okay? Because when you see his simulation manager, you will see there is quite a lot in that simulation manager. Now, of course, the nice thing too here is, and again, you can make these things invisible here in virtual reality. Now, you notice I am in viewer mode. Why am I in viewer mode? A lot of people ask. It's because one of the recommendations that we have started to make to our faculty is you should be in viewer mode, your students should be in VR mode. The nice thing about being in viewer mode, you can control all of this sort of back-end stuff while your students are actually in there doing their work, running their scenario. So it's really nice because you can control all the back-end, you can change things on the fly. There is quite the simulation manager to these newer patients. So we're calling these, right now we're calling them Gen 2 patients. But there's a lot of background, or there's a lot of information in the simulation manager. So we're going to go to the simulation manager here, and you can see the simulation manager has really grown. Okay, there is a lot of stuff in here, and it is honestly absolutely amazing. The amount of work and the amount of animation that it takes to get this done. Hey, all of the developers for Arch Virtual and for Acadicus. Wow, just amazing job, to be honest with you. So let's take a look here at some of the things. Obviously, we can change vital signs on this patient, but one of the kind of nice things too is for the vitals monitor, you can set it, excuse me, so that the value will not be visible until that piece of equipment is actually put on. So much like when, you ask for SpO2, right? But you haven't put the SpO2 probe, there it is laying right there, on the patient. You haven't put it on there. These can be set to be not visible until that piece of equipment is on. Now you can override that here by just clicking to override, and then you can turn the values on or off. So you can see no value right there if I turn it on, and there it is, okay? So I got both the heart rate and the waveform. Now, why would I want it to where I only have the heart rate and not the waveform? Well, if they put the SpO2 on, okay, and you've got the value visible there, and you've got the waveform visible there, well, maybe they didn't put the ECG on yet, so you can just turn that off. So now they'll only have that heart rate up there that's essentially reading from the SpO2. You can turn the other values on and off, so of course they can also look at the patient and see his breathing, and they can measure his breathing as well. And we'll talk a little bit more about that in some of the coming tutorials here. But then of course I can turn blood pressure on, and I can have all of these on, off, whatever way I like. Some of you may want to turn the waveform off on the blood pressure. Fine, no problem. Okay, so there you go. There you go. You have control. You have control. You have all the controls that you need here in the simulation manager. Now, the vitals monitor is separate out from the patient here. So the vitals monitor, you have to click on it in your objects over here to the left to see those settings. And then you can go back to your patient here, okay? And you can, okay, so I took his mask off and I had him face towards us so that you can see some of the animations. So let's talk a little bit about the animations here. And So you can see we can make him so that it looks like he's talking. Now, you can try to match his mouth movement a little bit if you're talking to your students, but it adds just a little bit more realism rather than having him kind of sitting there like this while you're talking for him. It just adds that little bit of realism. We can change his emotional state so we can make him look happy. There, he looks pretty happy there. We can have him looking sad. He's not too, he looks sad. And now he's angry. And he's definitely in pain. You can see he's kind of gritting his teeth. And then he is nauseous. He's kind of holding his stomach, and he's got his lips sort of, clenched together. And then, of course, we have the worried and then confused. Okay? And so you can put him into any of those states. Let's put him back into the neutral state. You can have head gestures, so you can have him nod, yes. And you can have him say, no, I disagree. All right. You can have him shrug, I don't know. And then you can say, hey, get out of here. Get away from me. All right. You saw that I turned his head left. You can obviously bring his head to the center, back to the right. I always like to have it sort of to the right as the student enters the door over there. That way it's kind of a little bit more realistic, like, he's looking at them as they come in. Okay. And then you can always move the head on the fly. It's actually pretty easy to just move his head around. You can also change his body positions. Now, this is quite extensive. And I'm going to back up just a little bit so you can kind of see. So there's that Fowler's at about 45. There's the Fowler's at about 30 degrees. You can have him in the Fowler's at 90 degrees. All right. You can have him in sort of a leaning forward. This is good for when your students want to listen to his lung sounds on his back. So you can put him in that leaning forward position. And then you can have him sitting on the edge of the bed. You can see he is just kind of sitting there. When we have a chair, the bed is gone, and you can bring a chair in, and you can have him just sitting in the chair. You can also have him sitting leaning forward in the chair, same thing. So more of a tripoding position if you wanted to do that. Supine, here we go. He's going to lay down. And again, I have all these controls on the fly. We can have him lateral recumbent right. Here's lateral recumbent left. Okay, pretty smooth animation there. And then we can also have him prone as well. So if we wanted him to turn all the way over, can you turn on over for me there? Thank you. We can have him laying full prone. We can have him in Sims position. And then, of course, we can have him in the standing position and falling position. Now, if I put him in a standing, he actually stands on top of the bed. And it looks a little odd. But, if you were thinking about using this patient as, maybe a psych patient, that's very possible, right? They could be standing right up there on top of the bed when you walk in, like, whoa, hey, can you do me a favor and sit down? He can be argumentative. No, I don't want to sit down, And then, once the student sort of de-escalates, talks him down, they can now, get him, hey, come on. And he finally does sit into, And again, you can kind of change that on the fly, which is really nice about this. So, hey, listen, more to come here. Make sure that you come back because I'm going to go over all of the different individual parts of the new Sim Manager on these new Gen 2 patients, and we're going to talk about each of them. So thank you so much for coming to this very brief little training, and I'll see you on the next one. You take care.